Okay, so let's look at the cycle here and looking at how it unfolds over time. So what happens initially is, and we're going to get to this on the next slide, is that we know from all of the research that pain and stress in childhood, trauma, has been linked to the creation of this cycle over time. So who is most susceptible for addiction? There is, and we call it genetic, but really I think of genetic as a brain-based pattern that is being carried down generation from generation. So I like to think of it as familial, even though we know with this delta phos-B that there is genes involved. So what happens is in early childhood, there's trauma, and that can either be severe trauma like sexual abuse or physical abuse, verbal abuse. It can be neglect. It can be just a dysfunctional family, that things were very dysfunctional and it created a traumatic response in that child's brain. But we know that trauma in childhood has been linked to being more likely to fall into addiction. So then what happens is the delta phos-B in that brain is triggered much earlier on in life, because we also know there's a study that shows that delta phos-B is more highly activated in pain and stress. So they go together. Delta phos-B is activated. Then what happens is the neurotransmitter released through the pathways in the reward system, like we just looked at. Then it's locked into memory and motivation and goal-directed behavior that is forcing it back towards that behavior. Then there's perpetuation of the cycle. And this can happen even without the behaviors. So when we get to the ending slides where I'm going to show you that neurofeedback's highly effective for, first of all, treating addiction, and secondly, for creating abstinence long term, which is super important. The reason that's super important is because we know that the delta phos-B doesn't turn back off. And it can, but it's tricky for that delta phos-B to turn itself off, and that's the dry drunk concept, if you've heard of that. Meaning that the brain hasn't changed, but a person is in abstinence, but their brain is still stuck in that chronic addictive state. And so, unfortunately, in some circles, honestly, I don't buy it, because I think neuroplasticity works across our lifetime if we work it hard enough. But the idea is if you just stop drinking or if you stop watching pornography, your brain actually isn't going to change unless you do something to change it, because it is stuck in this mode. So that's why they call people dry drunks, because even when people abstain from drinking, if they haven't done the work to change their brain back to that healthy activation level, it will stay in that same pattern that creates the craving and the longing. So let's look at the addiction cycle, and this is why it becomes so easy to relapse and so difficult to break the cycle unless you change the person's brain performance pattern. So there's internal frustration, which leads to the person fantasizing and thinking about the release that they're going to get once they get the substance or the behavior that they're longing. Then they start obsessing about that. And we know from research on addictions that the fantasizing and the obsessing can start to create that dopamine surge that the person is looking for even before they act out. And that is a really strong part of this cycle. Then they use the substance or they engage in the behavior, which then gives them another dopamine surge. And then many times they go overboard with that. And we know what it creates is, with that dopamine surge in the brain, it creates, it takes my favorite concept ever, a flow from Mihai Csikszentmihalyi, and I'm sure you've heard me talk about it in other videos. It takes that concept and it just ruins it for me, which is one thing that I don't like about addiction. But the idea is, when we are engaged, you've probably heard me say before, when we're engaged in work we love or we're helping people that we love, we lose time because our brain is just so in the flow of SMR and low beta and alpha. We're just in the zone in the middle. There's no high beta associated with it. There's no theta. We could do our work for hours. And if you've ever done that, where you've just got sucked into a project and you look up and it's 5 hours later and you're like, whoa, where'd the time go? Because you were enjoying that rhythm and hum of the zone. That is the healthy way to do it with our work. Unfortunately, in the addiction cycle, that's what the loss of control is. That person's brain gets into the flow and it's using alpha and SMR and low beta, and it's decreasing high beta and it's decreasing theta and delta, but all artificially, and and very harmfully for the person. But that is what makes them come back for it. That's what the dopamine surge does to the EEG. So that's why it's so tricky to break that. That's what we have to break. The longing for that, and we have to get the brain back to healthy activation levels, because there's actually nothing in life that can create this huge dump of dopamine in the first place, unless the person's into extreme sports and things like that, which even that might not give you the levels that a person gets from an addictive cycle. Okay, so after they use, people will be in a numbed out, zoned out feeling for hours or days sometimes, because their brain has just gotten that dopamine surge that they've wanted so badly. But then when they come down from that, there's guilt over use of the substance or the behavior, and this starts the shame cycle. So then they stop using for a while, and sometimes there's a purge. In some cycle wheels that you look at, they'll call it the purge, where the person will try to get help again if they know they're stuck in this cycle and they've been going through it over and over and over. Some people will reach out for help them, but then time passes and the internal frustration begins again and the cycle begins again. So what's important for me to have you to know is that during each one of these pieces of this cycle, the person's behavior changes. So internal frustration, you might see the addict acting out and being stressed out and ragey and angry and dissatisfied, nothing feeling good to them. Once they start fantasizing and obsessing, then it's called overly bright. The person might be overly bright and now they're in a great mood. So on Monday they were in a bad mood. Tuesday they're in a great mood. Why are they in a great mood? Because their brain knows that the relief is coming, because they plan on acting out. Then they act out and they're numbed out and zoned out, and they may not even be around people during that period. Then they feel guilty. And on the guilt end, what a lot of addicts do is they will do nice things for the people in their world because they feel guilty and they have shame inside. So an addict might buy his wife flowers because he knows he's acted out, even though he's told her he wouldn't do it. So now he's compensating for that, and then he stops using for a while and the cycle begins again. And this is a nasty, nasty cycle, but the person's behavior will shift. So it shows up in the person's world. So if someone reports that their behavior's all over the map, there could be something underneath it that is a full-blown addiction or an addiction brewing. Especially if that's a new behavior, you want to investigate that and stop it in its tracks. Okay, so how does the addiction cycle relate to EEG? Let's just get right into it. So this has been corroborated by science, is that ADHD and addictions are linked. Anxiety and addictions are linked. So what that means is too much use of theta makes it so the brain needs more stimulation. Theta's slow speed, the brain is shutting down. It is seeking more stimulation in the first place. Then, if a person has anxiety, that brain is seeking calming. It needs to be calmed down because it's running fast with all that high beta. And then we know, and if you've watched my workshop on ADHD and anxiety, you know that ADHD and anxiety are comorbid. So if a person's brain is performing out here in the extremes of high beta and theta, they need stimulation and calming simultaneously, which is what they will get from their addiction. At the same time, there's a trauma pattern to it. Trauma is a low power pattern in the brain. So if you see low power with excessive theta and excessive high beta, your patient or client might be at risk for a brewing addiction, especially during COVID-19. Okay, so let's think about the stages of addiction. It's on a continuum. And this is important if we're going to try to stop it in its tracks, is the continuum is social use or occasional use of the behavior or the substance. So if you drink every once in a while and it's socially, then that's not a problem. Then it becomes regular use. So if you start drinking every day at home, then that is moving in the wrong direction, obviously. Then there's problematic use or abuse, which means every day at home you're having 3 or 4 drinks. Then there's addiction and dependency, which means you can't go a day or two without having one, or your brain will move into withdrawal. And we know during withdrawal that the activation of the delta phos-B is increased, which makes the person want to get back to the addiction. Now we know from addictions too, from the science, that that the behavior starts as impulsive. So it's a person just impulsively doing the thing, but then it becomes compulsive, where they have to. There's the draw to go back. So at first it's not planned, and it's not that the nervous system needs to go back to it. In the end, it ends up becoming that way. So the way that it works is the first time a person watches pornography or has a drink for pleasure. So in an impulsive situation, you're doing the thing so to seek out pleasure. In the end, when it becomes compulsive, it's to avoid pain. It actually, in the end, generally doesn't bring the person pleasure anymore. It brings activation of the brain, which is the reward for the brain, but it's to escape pain. So that is the difference in the continuum, moving from social use, which would be impulsive or just you feel like you want to do it for a little bit of pleasure, to, in the end, addiction or dependency is compulsive. You have to do that, and it's to avoid the pain of reality or how your brain feels when it's just functioning without the addictive substance or behavior. And there's three main stages in that: preoccupation and anticipation in addiction. So we've already talked about this. This can give the dump into the brain of the dopamine surge. Then there's the binge or the intoxication. Again, you get another dopamine surge, and then withdrawal or the negative effect. And that is the opposite. It creates the longing, intense longing for the dopamine surge.